So good morning, everyone. I'm Maureen Brogan. I'm the program director of the Traumatic Loss Coalition out of Rutgers University Behavioral Healthcare. Thank you for spending this hot morning with us, and I hope you're someplace cool. Um, Today, I'm really fortunate to have Kim and Maya and Sierra join us to talk about athletes and specifically about suicide prevention as well as our experiences with mental health. So I know this has been a hot topic for many of you. We're glad that you're joining us. It is being recorded, so we can put it on the website if you wanted to review it. But at this time, I'm going to hand it over to Dr. Kim O'Brien, who many of you have come to our annual conferences or seen Kim. She's wonderful. So interested in the well-being of our young people and especially our athletes. So I think you're going to learn a lot, and Maya and Sierra are going to share their experience. And just so you know that they are professional athletes. So these are young women who've made it through the D1 to the professional stage. So I think we'll really learn a lot from them. So I thank you, Kim and Maya and Sierra, for being here. And Kim, I'm handing it over to you.
Awesome. Hi, everyone. I'm Kim O'Brien. It's great to be back here again, speaking with all of you about athlete mental health, which is a huge passion of mine. And we're so lucky to be here today with Sarah and Maya as well. I'll introduce myself first. For those who don't know me on this call, I'm a clinical social worker by training, and I run a company called Unlimited Resilience, which is a private practice, mental health practice for athletes by athletes. So all of our clinicians are athletes, and everyone we serve are athletes. I also have I'm a co-founder of a athlete peer mentoring program called Better Together, where Sierra is one of our mentors there. So Sierra, I'll pass it along to you first to introduce yourself.
Yeah, hi everyone. Thanks for being here. My name's Sierra. I grew up in San Diego. Sorry, I hope I'm not lagging. Yeah, I grew up in San Diego, went to play soccer at Stanford, with Maya, and we got to play 4 seasons together, which was awesome. And then continued to play professionally for the San Diego Wave, in the US, and then I'm now playing for a team in France. And I think just through my own experience with mental health in sport and then also experiencing loss in college, I just have learned the importance of sharing your experience and connecting with other people and feel really passionate about doing that. And so am excited to be on this call today. Maya, I'll pass it to you.
Hi everyone, happy to be here. As Sierra said, me and her played soccer together at Stanford, but I'm from Davis, California, and went to Stanford, studied human biology, and then played professional soccer in the Bay Area for 1 year, and I'm also now over in Europe playing professionally in Italy. And yeah, mental health has been something I've been passionate about for I think since starting in college, just experiencing my own challenges, dealing with the pressures that school and soccer bring, and then also experiencing the loss of two loved ones. So yeah, I feel like uh, being a part of programs that help anyone with their mental struggles is something that I'm very passionate about.
Awesome. So I'll give you all kind of the arc of of the presentation for what we're going to do today. So I'm going to start by talking or presenting a little bit on some of the unique mental health challenges that come about for athletes in sports. And throughout some of these talking points, Sarah and Maya are going to talk about their own personal perspectives with this, to talk about their own lived experience with mental health as college and professional athletes. And then we're going to shift into a discussion of losing a teammate to suicide, which Sierra and Maya have both experienced, and they're going to talk a little bit about their experience with that. And I'll speak a little bit to my experience of working with teams doing suicide bereavement. And then after that, we'll open it up to a little bit of Q&A. So what I want to show first, I'm going to share my screen for a minute because I think it's important for us before we really talk about the importance of mental health in sports. I think especially given, TLC's commitment to suicide awareness and understanding why this is so important, is that we need to really look at what the problem is here, and how suicide among college athletes has become a major problem. So I'm going to show I hope you can all see this. Sierra and Maya, tell me if you can't. But if you can all see this now, this is a two graphs that are on the causes of death among NCAA athletes by decade. So the one on the left is the causes of death from 2002 to 2012, and the one on the right is from 2012 to 2022. So as you can look at this, and I know it's some of the writing small, so it might be difficult, but what we can see is that you can see certain causes of death for athletes have decreased, like cardiac deaths have gone down, and so we also see that things like accidents have remained about stable. But one thing that we see on this graph that has actually doubled is suicide. So I think it's important that we look at this, because we're seeing the needle move on some other things through therapeutic interventions like cardiac deaths, but we're not seeing that. We're actually seeing the opposite happen for suicide. And then when we look specifically, I hope you can see this as I'm moving it, on this graph, we can see that college suicides are happening not over the summers when students are home, but this graph, which shows suicide deaths by athletes by day of week and month of year, we can see that this is happening, if you look at the one on the right, month of year, while they're in school. So we've got some major issues to manage here, and I'm hoping now it stopped sharing. Did it? Yeah. Okay. Good. So what I worked with a clinician and researcher named Elaine Anton Lotrulio, and she and I, it was, the work was led by her, but she did a systematic review of all of the literature on what differentiates or what are some of the unique risk factors for individuals who are college athletes, suicide versus non-athletes, because we wanted to take a look at, like, what are some of these unique risk factors that athletes face. So what I'm gonna I'll actually share my screen again, to just kind of show you this, show you the sorry, I'm having some trouble managing both things here, but to show you the um, article. I'm gonna, let's see, share screen. And I want to, just so that you can look at it if you wanted to. But this came out in Archives of Suicide Research just, I think, a couple months ago. But what we're going to go through is kind of the results and the risk factors that we found, which I'm trying to make it bigger here. But the main risk factors we found were: number one, the convergence of academic and athletic pressure; number two, toxic team culture; number three, barriers to accessing services; number four, complexities of the athlete identity; and five, experiences of injury. So I'm going to go through each of those now, kind of talk about them a little bit, and then I'll have Sierra and Maya kind of talk about their own experiences with those particular ones, and they can give kind of examples from their own lives or teammates' lives or what they've just seen around anecdotally. So let's start with this first one, this convergence of academic and athletic pressure. So athletes have a really unique experience that can serve as a risk factor for suicide, which is this compounded academic pressure and just the amount of time away from class that they have to spend so that they can spend their time in their athletics. There's just so many time demands on these athletes, and they can affect so many things like sleep and nutrition and other things that are so protective against suicide, all these time demands that athletes have to experience really can affect these things. There's also this pressure to perform in multiple areas of their life. Like, especially you'll hear Maya and Sierra talk about like their experience at Stanford with extremely high academic demands, in addition to their athletic demands. That, I mean, this is like a full-time job for a lot of these athletes. So, Sierra or Maya, do either of you want to start by kind of what you've seen, what you've experienced as academic and athletic pressure in your own lives?
Yeah, I can start, and then Maya, you can jump into, because I'm sure you've had different experiences. But I think, especially for Maya and I, I committed at the time. It was very different. So I committed to go play soccer at Stanford when I was like finishing up my freshman year of high school. So I still had a lot of time before I went, and I had known that, at Stanford you have to get into the school. So it's not necessarily a given, like you verbally commit, and I had talked to the coaches and made an agreement, but you don't sign anything. So nothing's for sure. So I felt a ton of stress and pressure because everyone knew that I was going to Stanford, because it was public, not like, when you're on teams, you tell people where you're committing, where you're going on visits. So everyone knew that I had committed to go play soccer at Stanford. And I was so afraid of not doing well enough in school that I wouldn't have gotten in. And then everyone would have known that. And so like, I remember in high school getting, a B on a math test and like crying and hiding it under my bed because I was so ashamed and embarrassed. And like the process even of taking the standardized testing, like I was I'm not a good test taker, and I was like studying so hard, and I remember just being so stressed the day before, and the day of, like not being able to eat and just putting so much pressure. Not even like my parents weren't pressuring me, but just the internal pressure, and knowing that like there's people around me that know that I'm good at soccer, and that know that I'm going, and like I don't want anyone to think less of me. And so just like it's hard as an athlete growing up, and especially when you're in these pressurized environments where people are so focused. Like when you tell people, "Oh, I'm going to Stanford," they're like, "Oh my gosh." And so to be in a situation where like maybe that wouldn't be the case felt really, really embarrassing to me. And then I think Maya, you can touch too a little bit more on like actually while you're at Stanford. But um, I think especially as female athletes, like there's this pressure to just feel like you're perfect in everything. And so that means like having it all together in the classroom, having it all together on the soccer field, when meanwhile, like, in college we would be finishing practice, like not even have time to take a shower because of the way that our practice schedule would be, and like jumping on our bikes in our sweaty training gear and like rushing off to lab, and then trying to pretend like we knew what was going on in lab, and then like rushing to dinner to be able to eat in time to be able to study afterwards. So it just, there's so many things that are pulling you. And I think for me, I always felt like I wanted other people to see me in such a positive light, and so I was so afraid of slipping in any area because I wanted to come across as like someone who has it all together and can excel in multiple areas of her life.
Yeah, super similar to Sierra. I mean, growing up and kind of having everyone have this image of you, and um, kind of living up to the expectations that people have, especially being an elite athlete and then also going to an institution like Stanford, people kind of start comparing themselves maybe to you and being like, oh, if she can do it, then like, why can't I? Or if she's going to Stanford, then, and she's only doing this, then like I should be able to go to Stanford. So it's kind of like that um, outside pressure from peers is one thing, and then there's outside pressure from maybe your coaches and maybe your parents. I was fortunate to have very supportive parents, so I didn't really feel that I had um, any extreme pressures in the classroom or on the field from parents, but I know a lot of people do these days, and I feel like that culture is increasing where you hear all these younger kids kind of saying like, "Oh, my mom said I should do this," or like, "Oh, I can't do that because my mom said I need to do more homework," or I need to go do personal training for my soccer. but yeah, it's hard not to care about what other people think of you, especially when there's social media that everyone knows exactly what's happening to everyone these days. Um, and yeah, trying to meet specific test scores or specific GPAs before you even get to college. Like Sierra said, we committed when we were freshmen in high school, and we didn't really have an idea of what we were doing. We just thought it was like cool that we were committing to this big school to play the sport we love. Um, and then actually getting to Stanford, um, it's kind of funny because there's this kind of, we call it floating duck syndrome. I don't know if anyone has heard about that, but I feel like everyone at Stanford's kind of doing the same thing where they're trying to do so much at once and trying to act and seem like they're doing perfectly fine and that they have everything under control, but like underwater you see ducks look like they're floating very calm and have everything under control on the top of the water, but then if you're looking under, all their legs are moving so fast to just keep them going. And that's kind of I feel like what a lot of students and student athletes feel at Stanford, because they're always comparing themselves to each other and trying to be the best in what they're doing, that they're willing to sacrifice maybe their mental well-being for a lot of these things. So, yeah, definitely the time management is something that you learn when you get there. It's hard to prepare for because you have all these people, maybe older teammates, telling you, "Oh yeah, I mean, it's gonna be a really big change for you." But it's bigger, usually bigger than you expect. And yeah, dealing with losing sleep, like the compounding of those hours that you're losing, like really take a toll on your mental health, and you kind of start letting go of good habits, and kind of acknowledging all of those things is what it takes to realize that your mental health is something that you need to prioritize while you're going through college, whether you're a student, an athlete, or both are at the same time. Um, but yeah, I feel like also Sierra kind of touched on it, like as you get older, that it's more of like a self-imposed or uh self-imposed pressure that's coming from within, because when you're in college you're not living with your parents anymore. You're kind of on your own, and especially if you're playing a sport and maybe a scholarship athlete, like you're trying to live up to those expectations, or be like, oh yes, I deserve this scholarship, so I need to perform well, and I need to perform well on the field and in the classroom. But yeah, sorry if I'm rambling, but that's kind of the experience I felt throughout high school and college as a student athlete.
Yeah, those both of you really illustrated that so well. I work with a lot of college athletes now, and it's just it it is so much on these young adults. It's really a lot. And I think when I look back at my own experience playing college hockey, back in the late 90s. Yeah, I'm pretty old, but it was so different. Yes, we had the same time constraints. However, we didn't have social media. We didn't have things that were just like also adding on to our time and seeing what other people are doing and seeing how we measure up. And I think that that adds a pressure, a layer that wasn't there um, when I was there. It's very different. It adds a lot more challenges for young athletes today. Anything else with pressures or anything that you wanted to talk about before we move on?
I think just adding, because I think what Maya said too is so huge of like the parent role in this. Um, I think yeah, Maya and I were both so fortunate to grow up in family environments that were very supportive and didn't put a ton of pressure on, but that's definitely not the case for most people that we've played with. And I think it is really hard because um, like getting a scholarship and playing a sport in college is such a good way to get your education, and it's a more affordable way. And so a lot of parents put a lot of pressure on their kids to do that because it's kind of a pathway to university and to education. And I think it's just like a good thing to know too as a parent that even without that, kids feel pressure because we want to do well for ourselves. We want to impress the people around us. And so just like I always say, like, come back to the reason that you played the sport, and it's for fun and it's because you love it, and to remember that, and that like most people aren't going to play their sport in college, and most people in college don't go on to play pro. Like most youth athletes are playing to learn valuable life lessons that you learn in sport, not to get a scholarship in college. And so just kind of like reminding parents of that, because it is really hard. And like as Kim, you said, it is different than when they grew up. It's like very different from generation to generation. So remembering like your kid is in this sport to enjoy it, to make friends, and to learn valuable lessons, not to go on and get a scholarship necessarily or play professionally.
Yeah, that's so important. And I think just like speaking to all the parents who may be on this call, like I also have 4 kids who are competitive athletes and love playing sports. And some of them play club sports. One even goes to a hockey academy. And I've had other parents say to me like, what's your end game with this? What do why are you doing? And I'm like, there's no end game. Like this is the game. Like they're learning so much from playing sports at a high level, learning, failing, and that sort of thing. Like I'm not trying to get my kid to get that. They're not playing sports for the outcome of getting the college scholarship. It's for the process of learning how to really work hard at something, make amazing friends along the way, and push themselves physically and mentally. So I think as much as we can as parents really embrace the process rather than the outcome of sports for young kids, I think the healthier their mentality around it will be. Let's shift a little bit into um, another risk factor for suicide among college athletes, which is if you have a toxic team culture. So, what we mean by a toxic team culture, that can look a lot of different ways, but one example is if there's a lot of yelling or critical coaching style, or maybe even abusive behavior by coaches. Now, that may be an extreme end, but there's, like we were talking about earlier, there are high expectations on these young athletes nowadays. So they're perceiving so many different criticisms now from coaches, that because they're getting negative things from everywhere. So it's being aware of that for any of the coaches that may be on this call, that kids nowadays are picking up on that more than back when I was a kid playing. Other types of things that contribute to a toxic team culture is hazing and any other form of interpersonal violence among teammates. That's what that does is when you experience that kind of dynamic on a team, it affects the psychological safety of the team and the young athletes themselves. To feel psychologically safe in a team environment, you have to feel safe taking risks. You have to feel respected by your teammates and by your coaching staff. And when you do feel psychologically safe in this environment, you're going to have stronger mental health and better performance. But when there is no perceived psychological safety, like if you have an abusive coach or you have hazing going on, or even just poor communication style among teammates, it's going to have long-term health and mental health implications, and it's also going to affect performance. So I don't know, do you have any thoughts on the importance of team culture, Sierra or Maya, and how it can contribute to either a positive or negative mental health for athletes in your own experiences?
Yeah, I mean, first of all, playing a team sport versus an individual sport is super different. I feel like when you're doing an individual sport, there is a little bit of a team aspect where you're around the same people in training, maybe around the people that are doing the same sport as you or same events and stuff, but you're not necessarily playing together if you're on an individual sport. Whereas as a team sport, everything depends on each other kind of. So there's that one factor is just trying to not just perform well for yourself and to kind of promote yourself so that you get maybe more playing time or that you get yeah, it's not just self-promoting. You also want to I mean, this is what I felt kind of, is that you want to try and work well with your teammates and also impress them in a way. You want to earn their respect. And coming in as a freshman on a team sport, uh, I did feel that I wanted or felt like I needed to earn the respect of my older teammates. Um, and I wouldn't say that's a toxic thing. I wouldn't say that my team at Stanford had a quote unquote toxic culture, but it was a very high level and high intensity um, environment that you kind of have to go into by yourself and make not a name for yourself, but kind of um, yeah, earn the respect of your teammates so that they feel that they can trust you to play on the field with them, or they feel that you can help the team do well and perform well and win games. Um, so yeah, there's always that aspect of wanting to impress your teammates and play well, not just for yourself. Um, and that comes with having expectations for each other, and how those expectations are maybe communicated can be in a very positive and nice way, or it could be in a very demanding or maybe not as nice way. And that's just because sometimes you have to communicate in urgent ways, and that doesn't always come out in the nicest way. So that's kind of, I feel like, uh, what kind of I experienced at Stanford, at least. It wasn't necessarily hazing or our coach yelling at us and kind of in an abusive way. It was more the team culture having very high expectations for each other and wanting to perform well for each other, and that comes with its own pressures.
Yeah, I would add on to, I just think that like um I've been a part of a lot of teams, and I've been a part of teams that are very cohesive and feel very supportive, and then teams that feel very like competitive and more quote unquote toxic. And you can never control how your playing time within a team, like it can change, it can fluctuate, coaches change, whatever. But from my experience, like the most important part and factor in terms of like my enjoyment of showing up every day and playing the sport is the team. Because um yeah, like some days it's going to be great and you're playing a ton, and then some days you're not, and it's so much better when you have people around you that are supportive. And I think one of the big things that's very different from, I mean, yes, in high school you're playing, if you play for a high school team, you're playing with people um from all different ages. But for me, like growing up, you're kind of always, oh, I'm one of the better players out here. So I automatically kind of have some sort of, I don't know, like I automatically have some sort of status within the team. And then when you get to Stanford, you're the youngest player, and the seniors that are there are like way, way better than you, way more decorated, and have had like serious college experience. And so that jump is like massive, like way harder than any other jump that you've done so far in your career. And so that was, as Maya said, like that's hard, because even though at Stanford we had such an incredible team culture. Like it was demanding, but it was so supportive. And I did feel like the people around me cared and wanted the best for me. But still, stepping into that environment when you have seniors who, um, yeah, have like done really, really well, and people that you admire, like you want to show up and you want to impress them. And so that does kind of put a lot of pressure on yourself, and can sometimes make, like I felt, especially my freshman year, I was so anxious every time before training, because I was like, oh, okay, like I really want to impress my coaches and I really want to impress my teammates. And so I think even in a very like positive team environment, it is hard. And then if you're in a toxic team environment, it just is like all that much more difficult. Because yeah, I think like in high school, I had a coach who was really aggressive and yelled like the whole game. And it's really hard when someone who you look up to and who you respect sometimes, but also someone who kind of holds your future, it feels like, in your hands, to be yelling and to be negative. And I think one thing that I've really noticed, as Kim said before too, from mentoring young athletes, is like the way that they capture and hold on to things that coaches say, both positive and negative. Like yeah, I was mentoring this young girl not too long ago, and she was just telling me that like when her coach says, you know, she's young, so she doesn't have all the language, but like when her coach says something positive, she feels really, really good. And then when her coach says something negative, she's like, oh, well, then it's just really hard for me for the next like multiple days. So the negative things actually hit her way harder than the positive things. And I think that's just like such a good reminder for coaches, because even for me, like I do some coaching and some private training, and I always try to think like, okay, even a one-off like negative comment can really stick with them for a long time. And so thinking about how I'm phrasing things and trying to be encouraging, but also like telling them what they need to hear, but thinking about the way that I'm doing it, because I think young kids do really latch on to things that coaches and people that they respect and care about their opinion say.
That's a really good point, Sierra, about focusing on what are some of the positive things that that coaches can do, or leaders can do, so that they can really empower their young athletes. I'm wondering if either of you have any other ideas or thoughts about what either coaches, captains, or any other like team leaders can do to, instead of avoiding or preventing a toxic environment, what can they do to promote like a strong culture of support and like psychological safety and positivity? You have any ideas, like, or like things you've experienced where for like the flip side rather than the risk factor, like the protective factor?
Yeah, I think one thing that was actually really cool for me in my career was when I started playing professionally. Um, I was also terrified because I was playing on this the field with these like incredible players who I grew up admiring and watching. And um, one thing that I really, really appreciated was that our one of the leaders on the team was the goalkeeper, the starting goalkeeper. And whenever I would be in games with her, she would always be like, she would always be encouraging me. And then when I would make a mistake, she would be like, I love that you tried that. Like, I love, like, keep going for it. I make mistakes all the time. And that was like so freeing for me, because I was like, okay, if someone who is a leader on this team sees me making mistakes and like loves that I'm trying it and is okay with that, like, that's so cool. And so I think as captains and as leaders of teams, you can like one, when people have a great training, like acknowledge it. I think that makes such a huge difference, especially for like younger players or new players. And then also when people like don't have a great training, like just show up for them and be like, hey, I thought you actually like did these things really well, or I love that you're trying that. And when people make mistakes, obviously there's, you know, if someone keeps making the same mistakes over and over again, it's different. But like when people make mistakes, encourage that, because a lot of times they are trying things, and you know, sometimes that's not the case. But I think that was something that really stood out to me and allowed me to play so much freer when I was in that environment.
Yeah, I think it's more about the athletes and the team when it comes to, I guess, toxic team culture, because your coach is gonna have authority no matter what. They're gonna have their job. It's not up to you what their decisions are and how they communicate. Um, like, you can always try to get them to maybe communicate in a different way, but ultimately it's out of your control. And I think that's when the team and the team captains, or just the team in general, can come together and create maybe traditions, or just like at Stanford, we had, I don't remember if Sierra, you were definitely here at the same time, when we would just have like, when you could tell the team or one person like wasn't doing well, or you could feel like the momentum change in a game, or maybe if a lot of people are like arguing or yelling at each other, like there's a word that you can all come up with as a team that someone says to kind of like reset and regroup and kind of acknowledge what the team goal is that we all want to win, we all want to do well. So we would have, I think one of the words we had was nails, which was like, if everything is out of your control during a game, or if you feel like things are getting out of hand, nails, we would all say nails to each other. And that means like, oh, like the only thing that you can control is working hard and working hard for each other. So like you're going to be tough as nails, like you're going to stitch that tackle for your teammate. You're just going to try and help out the team in any way you can. Um, and then we'd also, like, this is from Ted Lasso, but sometimes we would say like goldfish, because goldfish don't have a long-term memory, and you have to try and get over his mistakes as quick as possible. So like if you or your teammate are kind of um, in a slump, and you could tell that their confidence is low or your confidence is low, you can either say goldfish to yourself or kind of encourage your teammate to kind of reset and kind of give them some external confidence by telling them goldfish, like forget about the mistake you just made and focus on what you can do next instead. Um, so yeah, I think there's so many strategies and ways that I think the team itself and the players can promote a healthier environment instead of maybe the coach, because you can't really when a coach has a certain um coaching style, it's hard to change that. And if it's gonna be one that's pretty negative, it's finding ways to promote a positive environment in different ways, I guess.
Yeah, I love that. That's so true. I remember we did that in college too. If our coach would say a certain thing, we'd like kind of flip it a little bit on as like a joke. Oh, like, like she's saying this. Oh, and we'd like kind of say it to each other, like in a joking way. So it was like, doesn't get in our heads. We just kind of like, but I think that's really good. A great example. Um, let's now move on to another risk factor that comes up for athletes, college athletes specifically, which is the barriers to accessing services. Now, this is different across all universities. Like different schools have different types of barriers, but what we do know is that student athletes are less likely to seek mental health services than their non-athlete peers. Now, there are a lot of potential reasons for this. One could be the stigma of it, and that there's this pressure to hide it if they are experiencing what they may perceive as an experience of like mental weakness or emotional struggles. They may feel like they need to hide it to like put on a strong game face, that sort of thing. They may also worry that if they do seek help, that their coaches will find out and then make inferences that because they're seeking mental health support, that they're not mentally fit to play. They also worry sometimes if they seek services within the school that there might be concerns that it won't be confidential and that maybe, either their coaches will hear about it or their other teammates. Or they're also sometimes worried they may not be fully understood by by the clinicians who see them because they may not have an athlete background. Like some schools have their own sports psychologist on site, but a lot of schools don't have that. So they may feel that if they go seek help, that the clinician will understand the importance of their sport to them. Also, some schools help isn't really accessible. Like the wait lists are super long if they do want to see somebody, and they get limited amount of sessions sometimes. So I'm curious from you both, Maya and Sierra, if you've seen any of this on Stanford campus or know of friends on other campuses or any sort of experiences that you can illustrate for why it might be hard sometimes for athletes to access services.
Yeah, I think first off, across my experience and then talking to other people at other universities, like mental health resources are severely like underfunded, I would say. Like there's just not enough. And as Kim has presented, like there's a need and schools just aren't investing money into that, which I think needs to change. But yeah, I think there is definitely like a stigma around like taking care of your mental health. And I know like when I was at Stanford, we didn't necessarily have these conversations as much and didn't have we didn't use this language. And so I didn't think that really like anyone on the team was going to see a therapist. Like I just kind of thought that, I knew there were resources because when you come in like your first week, you have to do like a screening with the sports psychologist. So like I knew that they were there, but I just was like, oh, I don't think anyone goes to see them. And I think that there is kind of like Maya said with the like we call it like the Stanford Duck syndrome. Like you do kind of want to seem like you have it all together. And so by going to therapy, it almost felt like you were admitting that you don't and that you needed help, which felt to me like, I was kind of like I was almost giving up. Like it was kind of a weak thing. Um, but I remember my freshman year, I was like, okay, I redshirted my freshman year. I wasn't injured. I just my coaches were basically like, we don't think you're ready to play yet. And that was a really hard year for me. And so I kind of felt like I was like, all right, you know what? I got to the point where I was like, I need to get on the field. And so I'm going to take advantage of any resource that I have that can help me. And so I remember like you can call in, I booked my first I booked my first meeting with a sports psychologist. And I was so nervous to go in because where you sit to wait to go meet with the sports psychologist is the same like waiting area where you go to PT. So you're sitting there with all these athletes and you're kind of like, okay, are they going to see me as I go in? Because you either go like right to the PT room or left to see the sports psychologist. And I remember kind of just sitting there being like, oh, okay, like I hope none of my teammates are in here. Like I don't want them to think that I'm, like not strong enough to deal with the college environment. Um, and then I slowly kind of started to get over that. And the more that I went, I was like, okay, this is so helpful for me. And like, I actually don't care, but it took a lot of time. And I think the worry of coaches finding out is so huge. Like that in terms of just having conversations with other athletes, like that's the biggest thing because especially when you're in college, like you are fighting tooth and nail to get just even a couple minutes of playing time. And so it feels like to give your coach any little reason, no matter what that is, to maybe doubt your ability to play, you just can't do. And so that was really, really hard. And I think lastly, just to touch on the way that it can be so accessible. When I started playing professionally, we had a sports psychologist that traveled with the team and that was on site for every single training session. And it was so accessible, so easy. I remember showing up and I was like, oh, I really want to meet with her. But like, I wonder what's the vibe? Like, are most people on the team meeting with her? And then I saw like our captain walk in after training and going to meet with her. And I was like, oh, okay. So everyone clearly is meeting with her. And it was just so normalized. Like, people would have a tough training and they'd walk straight in with their cleats on, or you'd be like, oh, I have Lorna today. Like everyone would talk about it. And it was so normal. And she actually wouldn't wear any crested gear because she was like, I want to make sure that you guys know that I'm here for you and not for the club and not for the staff. And so that was like being in that environment where it was just so normal, so accessible, so easy was so incredible for me. And I just was like, wow, this is how it could be and this is how it should be. And so to see that was really, really cool.
Yeah, a very similar experience for me as with Sierra. I honestly saw like a big change and improvement during my time at Stanford with kind of like the stigma and accessibility of um, mental health, like psychiatric help and stuff. And I don't know if I think it's unfortunate to say, but I think it did take the death of our teammate and like that to affect the whole student body and the whole university in general for people to realize like how important seeking mental health help is. Um, and yeah, I guess coming into Stanford, like Sierra said, like you don't wanna show that you're struggling in any way. Um, and for me, my personal experience, I feel like I didn't really have many mental health struggles until I got to school or until I got to Stanford. And I feel like I kind of dealt with those struggles in a very reactive way. I kind of let myself go to the tipping point and then be like, okay, I'm really in a very bad place. What can I do to get back on track? Instead of seeing, um, like going to sports psych or not necessarily sports psych, but any psych in general, as a preventative or proactive way of dealing with your mental health struggles. Because my sophomore year, I think it was more, I was injured, I wasn't playing, and I think that had kind of had like an unconscious effect on my mental health. And I was also taking like the hardest classes I was for my major in that year. So I had like very acute anxiety and I for the longest time I was like, okay, it's gonna get better. Like I'm gonna figure this out on my own. Um, and it just wouldn't get better, and I would just let myself kind of drift and um dig myself in a deeper hole, and it wasn't till I felt like I hit a breaking point that I even asked my coach, was like, is there, like, who can I talk to? Because even though they tell you have all these resources, it's like not, like Sierra said, it's like not right in front of your face, where it's like, oh, this is what you need, this is who you need to talk to, and this is who you need to connect with in order to like schedule an appointment. And yes, like we are adults, like we should at that point like maybe know how to do that, but at the same time, um yeah, it's not right in front of your face to be like, oh, this is exactly what you're supposed to do. Also, there's no exact way of doing things as well. But yeah, like Sierra said too, on our professional teams now, we have a sports psych that has her, like ours at least, when I played in the Bay Area, she had her own office, our training facilities, and she would travel with us um on away trips like that. It was super accessible. So I think just like um the accessibility part is huge, but I think the stigma is improving. It's still there. And I really like, someone put in the chat like uh coaches definitely need to be informed more about um like struggle mental health struggles don't equal poor athletic performance. It's like that is only fixing those struggles is only going to help you perform, and getting help for that is only going to help you. It's not going to make you maybe take time away from soccer or whatever sport you're playing. Um, and also another thing that kind of uh made me think of something else, like adding in like a mental or like a sports psych appointment into your schedule may seem daunting and may seem like a huge like um may take away more time to study or more time to train on the field. But in order to do those things, you have to prioritize that to be able to do those school and sport to the best of your ability.
Thank you for that. The last risk factor that we identified in this systematic review for suicide among athletes is experiencing injury. Now, I know, Maya, you talked about yours a little bit here, but what we see when athletes experience injury, and it's different for all athletes. For some, the injury itself is a traumatic event that requires, some may require some like psychological intervention for. But in general, when you experience an injury, some may require surgery, some you're in rehab for a long time. And when you're out of that sport, it can really have an effect on your identity, and it can make you feel kind of disconnected from from your team, from what's happening for you, in the athletic arena. And when you try to, it's not just while you're out, but it's also really hard on your confidence coming back. So I don't know if either of you want to talk about your experiences with injury and how it's impacted you in your own mental health as an athlete.
But here.
Oh yeah, sorry. I was just trying. Yeah, I think, so when I was in high school, I tore my ACL, and that's like the worst injury I've had since then. And it's really hard because um you identify, like, most athletes, you're used to being like, oh, I can't go to that because I have training, or oh, I have a game or whatever, and um you really identify as an athlete. Like, that's how you view and how you see yourself. And so when you have a long-term injury where like that gets taken away for a significant period of time, like I didn't play in another game in 11 months after my surgery, so almost a year. And it was really, really hard because I also like loved going to soccer practice and I loved playing games. And then I knew I wasn't going to be able to do that for a long time. And so to have that pulled away, and then also to be isolated from the team, like I think that's a really, really hard piece of it. Because I think we talk a lot about like, oh, it's really tough, like mentally and physically, but also just like from the social aspect, you're used to showing up with these girls and like competing with them, and then all of a sudden you're away, and they're like going on. I was in high school at the time, so like they're going on these travel trips and they're sharing all these stories, and you're like, well, I wasn't a part of that. And so it can be a really lonely experience because you go from training with a team every day to then like either you and a PT doing your exercises or you doing exercises by yourself, and you go from being able to like train and scrimmage and play to trying to lift your leg in the air. Like it's very drastic differences, and so it's really challenging. um and I think the other thing that's really hard about injury is that like you're so used to your body responding in a certain way. Like that for me, like I was like, oh, okay, I do a squat and I can stand up and it feels great. And then all of a sudden you get injured and your body doesn't necessarily respond in the same way. So then when I would do a squat, as soon as I would get to a certain level, I would feel my knee just like light up. And there's nothing you can do. Like it's just the way that your body is. And then, you start cutting and you're like, oh, whoa, when I cut off my left leg, I feel so much more explosive versus my right. It just feels like I'm stuck in sand. Like you kind of have to relearn your body and your movements, and it's really frustrating because you're like, oh, well, I'm just going to be injured and then I'll be back, and it's going to, be quick and easy. And it takes time and it takes a lot of hills and valleys, and you're like, oh, okay, well, now it's feeling really good, and then something happens and you just feel like you have a lot less control over your body, which is really, really difficult. So um, I think one of the things that was really helpful for me um, when I was injured, and another reason why I like love mentoring and doing this kind of stuff, is um, talking to other people who had also had the same injury. And unfortunately, in women's soccer, I think like at Stanford, I don't know, 70% of our team had torn their ACLs, which is absurd. But so for me, like being able to talk to other people older than me or who were going through the same thing of like, oh, okay, is this what you were feeling at this time? That helped me feel kind of a sense of connectedness so that I didn't quite feel as isolated. But it's hard and it's not easy for any athlete. And I think especially when you're in the younger years of your life and your identity is a little bit more rocky and up and down, it's really, really hard to be pulled out of something like your sport for a long period of time.
Yeah, I mean, just not being able to play the sport you love is one thing, and I think I'll touch on something that's a little different than what Sierra said, but um, I never had a super serious injury until this past year when I was already I was a rookie on my professional team. But I think another challenge that comes with experiencing injury as an athlete in college and high school as a professional athlete is just kind of feeling like um, you're losing your spot on the team, and having to worry about, oh, I'm going to be out for this long. Is someone else going to kind of take my spot, or like, will I ever be getting the playing time I used to be after post injury? Um, because first of all, you're worried about like coming back and being the player you were before. I think some people, that's a big word for them, or some people don't even think about, oh, this injury is going to change my body and maybe I won't be able to do all the things that I was able to do before the injury. And then you're also worrying about, oh, is the coach going to give me opportunities after? Am I like last year on my professional team? I was like, oh, am I gonna get a contract next year? Is this gonna affect my whole career? Because there are some more minor injuries, and there's also major injuries that, I mean, a lot of professional athletes experience injuries, and as you get older, those injuries are at bigger risk of being career-ending injuries. So there's also that kind of anxiety that comes with, oh, will I be able to play my sport post injury? And will I get the opportunities from your coaches to be able to do so as well? So I think that's a huge worry that I hear, that I felt, and I also hear, I mentor young girls as well, and that's something that they worry about as well. I think even from an even younger age nowadays is kind of earning your spot back on the team, and getting the opportunities to play post injury. So I think that can take like a huge toll on your mental health, is worrying about something that is in the future, especially like you can really only control what you're doing in the moment, but it's so hard not to think about the positive or negative outcomes of injury.
And you both brought this up as you were talking about experiencing injury, but it brings up kind of the last unique risk factor for athletes for suicide, which is the complexities of the athlete identity. Because when you get injured, you lose that identity in some ways for a bit. So let's just take a little bit of time to talk about what we mean by the complexities of the athlete identity in general. So we have to see that for student athletes, there is a dual identity role for them, both as student and as athlete. And when we look at the athlete role, that can hold a lot of status in a lot of places, right? Where, you know, athletes are looked at like a little higher than some non-athletes in a lot of places. Along with that, there can be a lot of pressure, but in other places, the athlete role can have some stigma, like, oh, you're only here because of your sport. That was my experience as an athlete at Harvard. People would always say, don't wear your any of your issued gear to class, because you would automatically get, you know, discriminated against. The other thing about athlete identities is that when this role comes to an end at the, you know, fortunately for Sierra and Maya, they're able to maintain this athlete identity by playing pro, but they're in the minority. Most athletes are done after college. So this this identity coming to an end, you know, it can really create a sense of loss and disconnection at that point for these athletes. And they can be thinking like, without this athlete identity, who am I? So I don't know if either of you can speak a little bit about your experience with that.
Yeah, I think athlete identity is a huge topic that maybe a lot of people don't think about as athletes. They don't realize how much they identify themselves as an athlete, how much their family and friends identify them as just an athlete. Like when I come home from when I come home at all from school, or when I would come home from school, or now when I come home from my professional team, like the first thing people ask me is like, "Oh, how's soccer?" And I'm like, I'm excited to talk about soccer, but at the same time, I'm like, I'm also Maya Doms. I'm a person. Um, but yeah, it's crazy. I think for me, I definitely um my self identity was an athlete until just recently, when I realized that um, you're not an athlete forever, and you have to kind of think about what you enjoy outside of soccer, or when soccer's not going well. What's going to bring you happiness, and what are you going to be passionate about, and what are you going to work towards to make you feel fulfilled, and maybe be successful in a different career. Um, but yeah, I know even people in the professional realm, like I don't know if it's that they're hanging on to their identity as athlete, but they have no idea what they want to do post soccer. And sometimes maybe they're even hanging on to their sport in order to not face that decision, or trying to figure out their career outside of soccer. And that especially kind of uh we talked about injuries, like that's a huge time of when athletes maybe for the first time are realizing like how much time and like yeah, how much they see themselves only as an athlete. And it's only when that's taken away is when you kind of have to go through that challenging time and be like, okay, I need to find other things that really make me happy, or yeah, I guess in general, just um, yeah, sorry, I don't know where I was going with that. Sierra, if you want to add anything.
Yeah, no, I agree 100%. I think um just to like go what Maya said, the amount of times that I'm introduced as, oh, this is Sierra's the soccer player, and it always makes me angry when I hear that, because I'm like, no, I just like Maya said, I'm like, I'm so much more than that. Like that is what I do. And yes, I love it, but like I have so many other things that I'm interested in and passionate about. And so yeah, I think identity is something that I'm so passionate about because it's tough. And I think like growing up today also in social media age and just comparison, like identity is really hard to figure out. And it's hard as a young person to like identify, okay, what do I want my identity to be, and be really thoughtful about how you think about it. And so yeah, for me, like when I tore my ACL, I'm honestly like so grateful that it happened when it did, because my identity was so wrapped up in soccer at that time in my life. Like I would have a bad game and I would be in a bad mood for like weeks after that, because it just felt like it was everything. Like that's who I was. Everything was me as a soccer player. If soccer was going well, life was going well. If soccer wasn't going well, nothing in my life was going well. And when I tore my ACL and I was out for that period of time, I kind of had to like really think about, okay, I'm an athlete, yes, but like what other things am I passionate about? What other things am I interested in? And so I started just like reading a lot and learning more kind of about like meditation. I got really interested in that, and did some more just like I learned that I really love to read, and like listen to a lot of athletes talking about their lives and their careers, and started to just realize like, okay, yes, like soccer is so important to me and I want to put a lot of time and effort into it, but I also want to make sure that other things are important to me. And so I also like got way more involved in my church, and like found a community there and really loved that and poured into that. And so I think like that experience, and then also kind of strangely at Stanford, like Kim said, there also was this stigma around athletes, and like when you'd be in class, it was always like the athlete backpacking class. Like they're like, oh, they show up late and they don't try and whatever. And so in kind of a funny way, like I do feel like being at Stanford helped me broaden my identity, because I didn't want to just be the athlete. And I was like, okay, I want to take classes that I'm interested in and like really lean into these like intellectual interests that I have and these intellectual passions that I have. And so that was also like a huge point for me, where I was like, okay, I do really love what I'm learning about, and I want to pour into that and build that part of my identity. And so I think now, like in the role that I'm in, I feel really grateful that I do have that um, an identity that's greater than just a soccer player. Because, like Maya said, there's so many people that I'm playing with or have played with who are just so clearly unhappy in this sport, but they're so afraid to leave it because they have no idea what's next. Or people that are so wrapped up in the sport that like you can just feel the anxiety and the like pressures, because that is all that they have and that's all that they see themselves as. And it just is so yeah, it's so tough. And so I think just like starting to talk about that at a young age is so important, and understanding, because I think for me, I was like, well, I want to be good at soccer, so that's all I can think about and that's all I want to do. And you start to realize like, no, if that is the only thing, then it's actually detrimental, and can be a lot harder. And I think like one thing Kim taught me, that I actually did, Kim, with I do a little camp in the summer with some girls that are like 6 to 12, and I had them all do little identity pies, which was hilarious because the things that they put on there were like so awesome. But Kim talks about the identity pie of just like you have a pie and you have the things in your life on that pie, and some things can be bigger, some things can be smaller, but it's important to build that out and know what's important, and not have your sport be such a significant piece of the pie.
Awesome. Thank you both so much for talking about all of these different unique risk factors for college athlete suicide, and your own perspectives on it. I think one thing that hopefully most people who are attending this webinar haven't had to experience is their own death of a teammate. And I think it's important because the ripple effect of losing a teammate to suicide extends far beyond just the team itself, but it can really extend towards the entire campus community. So I'd love for each of you to talk a little bit about your experience in losing Katie, and how, what it felt like, and just describing any of your own lived experience about that. And then after you each speak about your own lived experience, I can talk a little bit about for the clinicians who are here, kind of what some of the important points are about working with athletes who have lost a teammate to suicide?
Yeah, I mean, I hope most people in here haven't experienced it because yeah, it's really tough. And I think for Maya and I too, like we lost a teammate, but we also lost a really close friend. And yeah, I think it's like you go through your career and you see like I'd seen it, happen in other environments, and you hear about it on the news and you're like, well, that will never happen to me kind of thing. And it does, and it feels just like um a horrible dream. Um, I think it was really, really hard because um everyone, Maya and I were captains at the time. Or yeah, Maya was leader. I don't whatever. Maya was about to be a captain. And we it was really hard because you lose someone on the team that, Katie was like larger than life personality. Everyone loved her and looked up to her and wanted her respect and wanted her love. And so to lose, and she was a captain. So to lose like her on the team was really, really hard because everyone responds in a very different way. And so like for me being a leader on the team, I just kind of felt like I was trying to figure out how to navigate it myself, and then to try to pull the team through it was like really, really difficult. And there were people that didn't want to show up to practice because they were like, well, this is a really tough place to be, and like stepping inside the locker room is impossible. And then there were people like me who I was like, if I don't do something, it's not going to be good. So like I need to go to training. I need to have some sense of routine and normalcy. And um, so Katie passed away in March, so we were luckily like in our spring season. So we were able to be very flexible, and our coaches luckily were supportive of, having optional practices and letting people kind of come and go. But then when the next fall came around, um, that was when it was kind of hard because leading into it, you know, for me, I was like, well, I know Katie, and I think I put too much pressure on myself of like Katie would want us to have a successful season. Like she would want us to finish, and especially like we were the same class and we had always talked about doing our 5th years together. And so I was like, she would want me to have a successful 5th year. And so I was really kind of putting too much pressure on myself as a player and then also a captain to be like, okay, let's like really get the team focused. Let's use this as inspiration. Like let's push. And I think in hindsight, just like you can't, it's really hard to know what people want and what people need. And it's really hard to push um and force that on people when that's not necessarily what they want. And so I think just like on the team level, it was really hard of trying to figure out what was needed and what support people needed too. And I think Stanford also didn't do the greatest job of supporting us in that. Like I I was the one that asked Kim to come and help work with the team because we really weren't getting a lot of resources from the university, and I just felt like I had no idea what to do, and a lot of people didn't know how to process it and express it. So from a team standpoint, it was really difficult. And then like the larger campus, um, yeah, I mean, like I remember so clearly still like the day she passed, like just like the way that the campus responded and reacted, and it felt like there was just like this massive cloud over everyone. And um, you just realize that like especially the student athlete community at Stanford is so connected and close. And so like my roommate was a water polo player and she was like, yeah, my team doesn't know what to do. Like we don't want to train. We don't like they're just you don't realize the ripple implications and like the way that people, even if you didn't know Katie, like you passed her and you heard her talking because she was so loud all the time, or you heard her joking around in the mealroom, like you had some sort of connection with her. And so a lot of teams didn't know what to do. And I think there's just like the administration of Stanford didn't know what to do. Our coaches didn't know what to do. Our sports psychologists like did not know what to do because none of these people were trained in it and none of them had experienced it. And so it just felt like we were in this environment where everyone's kind of like looking around like, okay, what's next? But then also everyone's grieving and everyone's trying to figure it out. And yeah, it kind of just felt like we were sinking. And I think like towards the end of my 5th year, it started to feel like it was maybe getting a little bit better. But for me, it honestly really took leaving Stanford to kind of feel like I was getting to a better place. And so, yeah, I think it was really, it was a difficult period, and definitely am super grateful that there's organizations that are able to kind of come in and step in and make the environment just a little bit safer and more supportive.
Yeah, I mean, a death of a teammate, a death of anyone in your life, especially by suicide, is just something that's so unexpected. You never think that it's going to happen to someone close to you in your life, or no, no matter what degree of closeness it is. But like Sierra touched on, having it happen to someone on your team and having to also deal with or feel like you have to deal with all your responsibilities still, like you don't want to really have to see that as a choice. Like you want to be able to grieve, you want to be able to prioritize like um caring for yourself and caring for everyone around, and even like thinking about everyone that was super close to Katie. Like you want to you want to be able to support them, but also um how to support yourself. And being on a team, it's also hard because everyone was like, Sierra was Katie's best friend, whereas like maybe there was a freshman on the team who wasn't super close to Katie, but now that's kind of a big part of their life in the present moment because um they were on the same team. And having to deal, or having everyone kind of be at different stages of grief is also a challenge in itself, because you have maybe some people who are ready to practice, and then there's some people who just can't even think about training. Um, like, what is the coach supposed to do in that moment? Is the coach supposed to try and um, encourage people to take time away from sport, or are they supposed to try and encourage people to see sport as maybe an outlet to get their mind off this super heavy, unfortunate thing that just happened? Um, and it's crazy how much of, at least personally, with the death of Katie, and then I also lost my dad to suicide a year after that. Like how much of your purpose is lost, especially with sport. Like I don't know if Sierra, you experience this at all, but like I was like, soccer doesn't even matter anymore. Um, but yeah, it's like seeing all these people, especially the not just the Stanford soccer team, but the Stanford athletic community in general, and just Stanford campus in general. You see how everyone's affected differently, and it's so hard to kind of get a grasp on what you're supposed to do in that situation because no one was expecting that to happen. Um, so yeah, it's just like super important to be super graceful with everyone, and kind of, even if someone's dealing with it in a different way than you are, you kind of have to try to understand that. And I think like death by suicide is obviously increasing in numbers, so we have to try and find ways to be more, not proactive about it, because you never want something like that to happen, but you want to be prepared just in case, just because it is an increasing cause of death in general. So yeah, just super hard to kind of deal with it at a team standpoint. And then kind of also like having, I what I thought was kind of interesting was that like going around campus, like everyone saw you as the teammate of someone who just passed away to suicide. Like it has kind of a stigma around it too. It's like kind of becomes part of your identity whether you want it to be or not. And then it's hard to deal with maybe that topic coming up and being like, oh, I wasn't even thinking about that, but now I am. So yeah, I mean the grieving process is a whole other thing. Um, but yeah, just every like having someone like Katie pass away, with someone who a lot of people knew. She touched so many people's hearts. She was had so many friends. Um, that's it's just hard to uh kind of figure out how to overcome, not necessarily overcome, but just um, understand how to work through um, a death like that, who that affects so many people, and so many people deal with it in different ways.
Thank you both for opening up about this and just speaking really honestly about the emotions you had in this time. I think in addition to how it affects teammates, it's also really important for clinicians to understand kind of the process or the way you can work with teams following suicide death. I'm going to put in the chat. I recently collaborated with two people from my company, Unlimited Resilience, and wrote this article about, because there's really nothing out there about how to work with teams. So it gives a little bit of a framework. But I'm going to speak kind of about, it's kind of the way I developed this framework is kind of like a little layered system of what needs to happen before the next thing. I'm going to share a little bit with you, and then I don't know if Sierra or Maya have any additional thoughts about that and that kind of work, and their own experience with it, how that might look. But I think when you're first starting to work with the team following a suicide death, is you need to ensure the psychological safety of everybody on that team, coaches, athletes. It's so critical because and I noticed this more in a recent work with the high school team I did, but there was so much guilt and shame um, in that community, that team, that high school team about that specific death that we had to do a lot of work making them feel safe enough to even have these conversations with each other. So I think it's making sure you have a pulse on, is everyone here feeling okay? You know, feeling safe in this conversation, which can be a really hard thing to do. Once you've kind of starting to establish this psychological safety, then you need to do some psychoeducation on not just the grief process, which is very important too, but also on why grieving a suicide death is different from grieving other types of deaths. And once you're kind of going on that layer, then you can start helping teams with building internal coping skills that they can use as individuals to cope with the grief they're experiencing or any other strong emotions or behavioral reactions they're having to the suicide death. And then, in addition to that, you need to work on helping the team develop communication strategies that work with each other when maybe one athlete's having a hard day and another one is then and another athlete might want to know how to support that athlete but doesn't know the best way to, so it's how to best communicate with each other about what they need in those moments. And then this last step is moving forward, with the team in, how do you then like commemorate the athlete in a way that is appropriate, um, and is helpful in getting the entire team to be able to move forward, um, uh, beyond the death of a teammate. So feel free to take a look at that article if you want, and hopefully it's helpful to some people. But I'm curious, Sierra or Maya, any thoughts for either of you about just the experience as a team of doing some of that suicide bereavement work?
Yeah, I think the piece that you said about the commemorating the athlete and celebrating the athlete um, is like was a big for us. I remember like my fifth year. So when she passed that next season, I would put like a captain's armband every home game on the goalpost that like she used to be in. And that was really helpful to just be able to be like, okay, I'm kind of honoring her and she feels like she's here. Um, because yeah, it does feel doing those little things were so helpful. And I can't remember everything that we did, honestly. But there were definitely things that we did while we were that last season that I was there to kind of commemorate and honor her. And we did a mental health game, and I think we like painted KM, her initials on the field, and all of those little things made a really big difference. And I think having that and being told that, like, no, this is good and this is helpful was huge for me individually, and then I think also for the team.
Any thoughts, Maya? Or
Yeah, I mean, I thought we kind of celebrated Katie in the best way we could, and I think that did help. That did help our team kind of um, progress in our grief, and also it gave us another kind of motivator or a purpose to play. Whereas like when it first happened, it feels like your purpose of playing maybe is totally lost. But then when you commemorate someone that everyone cared about, and that is something also like dealing with a death within a team is like you don't feel alone in the grieving process, which helps so much because being able to relate to someone in the most unfortunate way does help in having open conversations and being able to be vulnerable with each other. Um, but yeah, just being able to commemorate someone that everyone loves so much, it just gives so much more purpose behind to where we're playing and kind of makes it easier to be able to play because you're like as it's kind of like a um not selfless but like you're playing for a bigger purpose which you're not it makes people kind of yeah less selfish. It's not as much about like your individual promotion or your individual performance but more um how you're going to do well as a team and showing that being a strong and connected and close team is what is going to help teams be successful, no matter what challenge or an unfortunate situation a team has been in.
well, thank you both for sharing so openly and honestly about it. And I just think as clinicians working with teams who've experienced the loss of a teammate to suicide, we have to understand what a responsibility and a privilege it is to be let into young people's lives when this happens. And also, there's no right way to do this work. There's no scripted way. That's why, like, when I wrote this article, it was like, this is a framework that should be flexible because every team dynamic is different. The way every individual on the team responds to the suicide is going to be different. There's just so many dynamics that happen. So I think the most important thing that us as clinicians have to pay attention to is that, it's not like something that is a manualized scripted way to work with people. Like, I think a key part is like really using like the leaders on the team to be the barometer for the rest of the team and how they're doing, and to ask, what do you need, what do you think you need? They may not know, but to try to really figure out like what are the struggles right now, what's happening, and then just be creative and think outside the box on how to address some of these things. All right, I know we only have like 5 minutes left. I don't know, Maureen, if you think it's helpful for us to open it up for any, question and answer, or if you have any other thoughts on anything you want or need for the last 5 minutes.
Yeah, does anybody have a specific question that they want to ask him or Sierra or Maya? A lot of gratitude in the chat, just so if you guys haven't been able to see it. Some requests like, would you come to New Jersey and present live? So that's that's a request. Kim, I know you know how to get to New Jersey.
Yeah, I just drove through Rutgers the other day, coming back from Pennsylvania.
Right.
Or lacrosse
So
tournament.
does anyone have, because we have like 5 minutes, does anyone have like a pressing question that they would like to? You could unmute, everyone can unmute or put it in the chat. I'll look for it. Selfishly, I am going to self-promote, not Maureen Brogan, but the Traumatic Loss Coalition. Hopefully you know the Traumatic Loss Coalition because you obviously got our flyer, but also too, we do provide postvention. So the Traumatic Loss Coalition has gone out to club teams and high school teams when there's been a death by suicide. So we do have that. We're really fortunate here in New Jersey to have that resource, no charge. And we really just offer the guidance. Like Kim had said, it's following and getting the pulse of the team and just supporting that way. And what we've found too is that we'll respond to the school, but when you're talking about a group of athletes, it's another dynamic that's pulled in, and they need special attention in a different way to keep moving forward. So I threw our link in the chat, but also to Kim and Sierra and Maya were so gracious to let me record it, that this will also be on our website. So I'm going to make you go through our website to get a recording.
That's great. Maureen,
How
can
is
I
that
actually
self-serving?
can I promote one thing, Maureen, that I
Sure,
think is so
floor is
important?
yours.
Sierra and Maya, can you talk about your new podcast that you're doing? Because I think it's so awesome, and I think people here would love it. So I don't know, maybe one of you can put, I don't know if there's like a link in the chat or anything like that, but one of you talk about
I
it. One
can
of you
find it. Yeah, I can find the link. Basically, me and Maya are both mentors for this organization called Female Footballers that does mentorship for young female soccer players. And the organization asked us if we wanted to do a podcast kind of under their umbrella. So me and Maya have started this podcast called Beyond the Game, where we just talk to people we know and friends, and talk about kind of like the mental tools that people are using, the mental struggles, things that are happening kind of below the surface that aren't necessarily shared on social media. And we actually just interviewed Kim. It was awesome for May Mental Health Awareness Month. And then we interviewed other soccer players like Naomi Girma, Kennedy Wesley, and we just did a interview that's coming out soon with one of our old we actually didn't play with her, but someone from Stanford who she is pregnant. And so we got to kind of talk to her a little bit about like building a family and navigating that with playing and having a career. So yeah, thanks, Kim, for putting that in there.
Chat.
Yeah, thank you.
Yeah. Yeah. So
I have a quick question if there's still time.
Yeah.
Okay. Hi, I'm Justina. I work with Nairobi, Eric, and Meg Murphy, who are also on this call. We are an organization that does prevention work in New Jersey to prevent mental health and struggles and things like that from happening as best we can. And I'm just wondering for Sierra and Maya, number one, thank you so much for sharing. We got so much information, and I just wanted to piggyback off of Meg Murphy's comment that she made earlier about awareness and coaches being aware and how you guys tied that in. But what do you think, and this is a loaded question, might have been helpful when you were in middle school or high school to help prepare you for these things that you might have encountered, or what do you think you need to hear or learn about? Whatever comes to mind would be wonderful. Thank you.
Good question. Do you mean like more from a suicide perspective, or from just like an athlete mental health perspective?
Anything that you feel would be relevant, maybe athlete mental health perspective in particular. That's a population that we encounter a lot, but we don't have like specific programming for in our workplace. So if you have any personal experiences or anything about that, that would be cool to hear about.
I think just I always, like if you can kind of destigmatize help seeking and talking about mental health at a young age, I think it makes a huge difference. And so I think when working, like something that I just wish that I had kind of more language to be able to talk about, the things that I was feeling and what I was going through as a kid, and to just know that like that's normal and that's okay, and that a lot of people are experiencing that. And just like, more conversations. I think something that I try to do now is like be very open about being like, I go to therapy, and I see people to help me with my mental health. And just like as older people and as people that young athletes, young people are looking up to, is like, oh yeah, this is normal and this is okay. So I think just normalizing help seeking at a young age is the biggest thing that would be helpful for that I wish I had.
Yeah, I totally agree with that. And then also just I think informing parents and coaches could be huge. Just because I feel like it's maybe like an older generation thing, but like I know so many older players or even like super big scale players that they were told to kind of hide their mental health struggles, or like if if they're showing any form of vulnerability or weakness, that's seen as being soft. Whereas I now definitely think the culture and stigma around mental health is definitely improving, but just I think informing parents and coaches that being very understanding about mental health struggles that any athlete or any person at any age are going through, it should not be seen as being soft or something that's going to hinder their performance. Because I know so many people, like being a mentor to very young girls with through the program that Sierra mentioned. You see how much parents are invested in their kids and almost maybe living vicariously through them and their sport. You see how much pressure like a 10-year-old is getting from their parents to really prioritize soccer and set up their future to be able to play soccer and maybe make a career living out of it. So informing parents to for their kids to maybe um, just being graceful with their kids and allowing their kids to be vulnerable, because I feel like those parents that are maybe put a little more pressure on their kids and maybe making them do too much are the ones that their kids are maybe not going to share what struggles they're going through. And then also from a coaching perspective, just experiencing like even uh I feel like it took maybe the death of Katie for coaches to realize like people are struggling and they maybe don't see that on the field, because on the field, like all the players are just focusing on performing well. It's not about necessarily their life outside of the field. So just understanding that everyone has stuff going on, um, and maybe informing coaches on making that conversation less stigmatizing and kind of maybe engaging with their players on a more personal level, whether that's just checking in on how they're doing or yeah, like it is time consuming to try and check in on all your players, but kind of just acknowledging like or looking for signs of someone that may not be super present at practice or just blatantly having a bad day, being able to check in on your players and opening up that conversation.
Thank you so much.
Maya, Sierra, Kim, thank you so much for your time, for sharing your lived experience, making yourselves vulnerable and sharing that with us. Kim, for your guidance. You know you're welcome here in New Jersey anytime. So we'll be talking more because we'd love to see you in person. So everyone stay cool. Thank you for joining us. A recording will be on the website. And I will also send the additional resources that were put in the chat and the podcast and all of that when we send out an email to all of you with the link. So stay well, everyone. Enjoy the start of your summer. Stay cool. It's 90. Stay indoors. Stay well.
Thanks for having us, Maureen.
Thank you.
Bye. Thank you.